Doctor, si le puedo preguntar en español, por favor. Hoy día el CDC dijo que no estaban preparados para decir que el problema estaba bajo control en los Estados Unidos, sin embargo había señales muy positivas. ¿Usted está de acuerdo con esa evaluación?
Si yo entiendo bien, CDC está hablando sobre la situación en Estados Unidos y en este tema estamos en comunicación por cada hora más o menos con nuestros colegas en CDC. Y la situación está cambiando hora a hora. Como yo mencioné, yo sé que en el laboratorio de CDC hay más de 700 muestras bajo de investigación. Lo que es bien para nosotros es de todos los casos, menos de, creo que 0.7% de los casos confirmados fueron hospitalizados. Entonces, para mí es una indicación que la infección, la enfermedad, queda en una manera no tan severa.
Doctor, a tanto tiempo, bueno, casi un mes de que se comenzaron a detectar los casos, se creó una comisión trinacional entre México, Estados Unidos y Canadá para analizar las causas de la mayor mortalidad de este virus en México, en contraste con lo que ha ocurrido en Estados Unidos. ¿Por qué no se ha llegado a determinar cuál fue el factor que hizo que este virus cobrara más víctimas en México? Y también, ¿qué posibilidades existen de que este sea un virus similar al que provocó la epidemia en 1918, que según reportes comenzó también no tan severo, pero que regresó a fin de año con mayor fuerza?
En relación a su primera pregunta, hay muchos factores que están cambiando otra vez cada día. Creo que con el trabajo enorme para finalizar las muestras en el laboratorio van a producir una vista con más claridad. Pero también sabemos que hay un estudio que muy científico, un estudio caso control que van a dar más luz en términos de riesgos o factores de riesgos de la enfermedad. Y por eso yo mencioné en la presentación, pero este estudio es muy, muy importante. A fin de día, vamos a decir este virus de México es diferente de este virus de Estados Unidos. En mi opinión, probablemente no, pero por eso es importante a determinar los factores de riesgo, porque hay personas que viven en condiciones pobres y es información que podemos usar a mejorar las condiciones que contribuyen a la enfermedad.
Y la otra pregunta en relación a la posibilidad de que este sea un virus que viene atacando no con tanta severidad ahora, pero que pueda regresar posteriormente con más fuerza.
Esa es una pregunta muy interesante y en la verdad no sé, pero es posible y todo es posible con estos tipos de virus RNA. Como mencioné, they are predictable in their unpredictability. Pero es posible tener una transmisión de un virus que no sabemos, pero en un momento hay un evento que causa la emergence de este foto.
Doctor, pero por lo que usted dice, en México podría determinarse la condición socioeconómica de las víctimas para establecer si fue la falta de higiene o condiciones de pobreza lo que incidió más en las muertes.
En relación a esta pregunta, yo entiendo con el informe del Ministerio hoy que el porcentaje en términos de los muertes, por ejemplo, el porcentaje de los casos que no están trabajando fue como 5%, fue menor. Entonces, me indica que estos son trabajadores con una vida de trabajo, pero es importante entender todo la vista.
Okay, do we have any questions from the people on the phones? John, we have one question from Nestor Iqueda, the correspondent of the Associated Press for Latin America, who asks if we can amplify a little bit more about the risks of the Southern Cone with the change in season coming up, and how does the cold really affect dissemination of the virus, of the flu virus?
I think it's concerning that in the countries of the Southern Hemisphere, they're just entering the winter season, which traditionally has been the flu season. There are ecologic conditions that contribute to the transmissibility of influenza viruses in general. And that explains why in temperate countries you see seasonal outbreaks. And I think that is a concern and fear that we have for this current virus as the southern countries go into their winter season. There probably are it's multifactorial, but populations in the winter are more likely to stay confined in closed areas, and perhaps transmission is increased in such conditions. And there are a number of other reasons why in temperate climates the virus is more transmissible. But I think that one immediately comes to mind and is most logical.
Yeah, I'm David Brown from the Washington Post. Are there any states in Mexico where where cases have not been found? In other words, is there evidence that it is still invading regions and populations, or is it now found throughout all of Mexico?
I believe it's more the latter, and just before coming here, I came from one of our teleconference calls with the ministry and our partners, and I can't remember the exact number, but it's closing in on virtually all the states of Mexico, and we're seeing the same phenomenon in the U.S. So I don't know, I can't say specifically which states have not reported cases. Yeah.
Just sort of following up on that, realizing it's very speculative at this point, is it possible to sort of work back from the current kinetics of the epidemic we're seeing now to say that this probably has been spreading in Mexico for 3 months, 4 months, since before Christmas, last fall, only since the last 6 weeks? Is there any, what are the early thoughts on how long it's been circulating in Mexico?
I think that right now all our attention should be focused on controlling this outbreak. That's not to say, however, that there might be specimens in the lab that when the dust settles or when we come up for air that certain studies could not be done. And so I would really call upon all of us to stay focused on what we need to do today to control this outbreak and look forward. But it is an interesting question, and someone could come back and, for example, go to the laboratory and reinvestigate those specimens.
Nunu Japaridze from CNN. You mentioned that it's going to take 4 to 6 months to develop the vaccine. What is your understanding why it's taking this long? Is it because we are dealing with something unknown, or is there any other obstacles that...
I remember it wasn't very long ago, perhaps a year or two, maybe 3 years max, where when that question was asked, the response was 8 months, 8 to 9 months. So what that means and what that's telling us is that, again, all this work over the last 2 to 3 years preparing for an H5N1 pandemic has really paid off in terms of the technologies that have been produced. Reverse genetics is one of those technologies. And so what we know about this genome, it has been sequenced. So we know the sequence of every nucleotide in the RNA of this virus. And then experts know where on that sequence of nucleotides, which nucleotides are responsible for coding for the important surface antigens. And the two most important surface antigens are H1 and the other one is the N1. So knowing that sequence of nucleotides, you can then work backwards, hence the name reverse genetics, to produce those two antigens that would go into a vaccine that would provide the necessary protective immunity. And that has really expedited this whole process. The traditional cell culture where you take the virus, the seed strain of the virus, and you put it in an egg. And for every, one way to think of that, it's a tremendous amount of work, because for every dose of vaccine that you give, it takes about 1 egg. So that's millions of eggs. And to generate those eggs and the amount of chickens involved and so on, it's a huge operation. But even that process has been streamlined to the extent possible over these last 3 years. So when I give that range, regardless of those techniques, we're seeing the benefits. And the other thing that I find from a scientific perspective is that, you know, it's really a new organism that we're producing a vaccine for, and that needs to be taken into consideration. A new organism in the sense it's a new strain. Yeah.
Okay, thanks, John. We have a lot of questions on the board from people all over Latin America. One reporter from Mexico writes, is it possible that this virus originated in the United States and traveled to Mexico before spreading there and coming back?
Again, all options are on the table. It's so unpredictable.
And then, so we have a question from Argentina, Gabriel Maldonado Gómez, que pregunta, en caso de que la OMS declare el nivel 6 de alerta, ¿qué cambios habría en la relación entre países afectados y no afectados? ¿Está el mundo actual preparado para enfrentar las medidas de prevención que reclamaría una pandemia declarada oficialmente?
Gracias para la pregunta, es una pregunta excelente. Es importante entender dos cosas separadas. Una cosa es el trabajo que estamos haciendo, que yo mencioné en la presentación. Trabajo enorme para desarrollar una vacuna, trabajo de campo para mejorar la vigilancia, trabajo de comunicación para informar la pública. Todo este trabajo es muy importante en un nivel de 100%, creo, en términos de capacidad de los países. Pero el trabajo para determinar el fase de este brote es trabajo a usar la información a determinar el nivel de alerta. Y para mí, a fin de día, con el fase 5 hoy, creo que cuando yo veo todas las personas en esta sala, cuando hablamos con nuestros colegas en el campo, ellos están corriendo más de 100 miles an hour. Entonces, creo, mi mensaje es que estamos haciendo todo lo que es posible a preparar por más casos para hacer las cosas más efectividad para controlar el brote. Fase 6, por definición, dice que hay transmisión sostenible en la comunidad en más de una región, entonces en 2 o 3 regiones. Pero la situación hoy, estamos en una situación en fase 5, donde tenemos transmisión sostenible en la comunidad en 2 países de las Américas, México y Estados Unidos. Y tenemos casos reportados en casi cada esquina del mundo. Está involucrando muy rápido. Pero sí, en este momento no puedo decir si vamos a entrar fase 5 o vamos a bajar a fase 4. Las 2 opciones son posibles. Pero en relación a la primera opción, si mañana o qué día la directora general de OMS dice estamos en fase 5, las acciones son es un mensaje a todos los países del mundo para obtener su plan de emergencia y activarlo. Pero como yo mencioné, cuando estamos hablando con cada país de nuestra región, ellos están trabajando en muy similar a esta definición.
We have a question from Ricardo Morales in Costa Rica asking, how probable is it that the regular or seasonal influenza vaccine may offer any cross protection? And why, in this case, were middle-aged adults more prone to infection than children and the elderly? Could it be that the vaccine offered children some protection and the 1976 outbreak immunized some of the older adults?
That's a very interesting question, and that has been hypothesized, that perhaps exposure to the 1976 or other outbreaks may have provided cross protection. But what we do know about the current seasonal vaccine that was used this past flu season in the Northern Hemisphere is the following. CDC has used sera from individuals who participated in the clinical trials for the development of the seasonal influenza vaccine that we just used. And using that sera, they can then test the virus that's been isolated and determine if there's any cross protection. And they've yet been unable to show that. There's been some suggestion, and it's only a small amount of information, that perhaps older people might receive a little bit of cross protection, but I don't think from a public health standpoint that it will be a benefit. So I think we need to go into this really focused on the fact that the current seasonal vaccine that's being used will offer no protection in this current situation. I think that's the important message, and that's the kind of message that will drive our interventions to control the outbreak.
Okay, we have another question from the Associated Press that relates to travel restrictions, really. He's asking about countries that have imposed flight restrictions to Mexico, and that has, caused tension in their relations. Can you elaborate on PAHO and WHO's recommendations with respect to travel restrictions and border closures?
At the moment, you know, it's very important to recognize that PAHO nor WHO is recommending any sort of travel restrictions other than those individual recommendations I mentioned. If I develop a fever now and I have a flight scheduled this evening to go to Mexico City, I should cancel my flight. And similarly, if I'm coming back from Hawaii and I come down with a fever, I should go to my doctor and seek medical advice. But in no way is WHO or PAHO recommending that there should be travel restrictions, nor are we recommending there should be any border closings, because we know it will have no impact on the public health conditions or transmission of this virus as we know it. It's interesting, Dan, as you asked that question, I was thinking back in a former life, being in New Delhi, India in the mid-1990s when the plague scare hit India. Some of you may remember plague it was thought to be diagnosed a cluster of deaths in one of the states, and embassies closed down their embassies, the airlines refused to travel, and to this day I don't think that outbreak has been determined, and I believe most authorities may question whether it had been plague. So that was an overreaction to a situation, and we certainly don't want to overreact, and there's no indication to close borders or restrict travel in the terms I mentioned.
Here's a real softball question. What's the best source of information on internet for health professionals to obtain up-to-date information about this outbreak?
Thanks. There's, I think if you go on to the WHO and PAHO websites, you'll see a wealth of information on all the scientific information available. CDC also publishes its American Committee on Immunization Practice report that is published regularly, and there's one from a year or two ago on influenza that's a very comprehensive review as well.
Okay, and then we have another one from Mexico, from Uno Más Uno, who asks, ¿a qué se debe que miles de personas, principalmente en los países subdesarrollados, que viven de la pepena de la basura, hasta la fecha no sean foco de esta epidemia? ¿Por qué no se ha desarrollado esta epidemia entre gente que vive en la basura?
Yeah. Yo sé, yo veo estas comunidades, y es posible que estas comunidades son aislados, entonces no hay contacto, porque son condiciones muy pobres.
Okay. Any other questions from inside the room? ¿No hay más en línea?
Yes, sir. 4 more.
Another question asking again from INSP Mexico if we have a better understanding of why the lethality is higher in Mexico. I think you sort of answered that, unless you want to extend on it anymore.
I think I've provided as much information as I can. I think that there are other factors. The case definition has changed. Initially, the case definition being used in Mexico was focused on hospitalized patients, so that you can see how that would bias your understanding of the nature of the illness if you're only looking at hospitalized patients, as opposed to looking at all people who come down with influenza-like illness. Just again, thank you, members of the press, for taking the time to listen to our briefing. Very much appreciated. Thank you.